Wales has problems with recruiting junior doctors and middle grade staff across a number of specialties. It's not isolated just to Wales. In some specialties it is a UK-wide phenomenon. However, we do seem to suffer worse here in Wales in particular specialties, and therefore we need to centralise the training experience that this lesser number of trainees actually have. We're spreading our trainees far too thin across far too many hospitals, so that the working time directive, which restricts the number of hours that they work, isn't fulfilled for many of them. That also means, because it isn't fulfilled, that they don't get the time off that they need for teaching on a one-to-one and group basis. So in order to improve the experience of the trainee doctor, who of course will be the future doctors for Wales, to offer the best care to our patients, we need to ensure that they get adequate and protected time for teaching. And that means they will have to be on less sites than they currently are. It certainly extends across the range of doctors that are required to provide the service here in Wales. So the non-training grade doctors we've had problems with. Part of that was due to the changes to the immigration rules. Although Wales always had a preponderance of those doctors, again we've suffered through the immigration with them not coming to Wales. The consultant grades also in some specialties we don't have sufficient numbers in, and again you could track that back in some ways to the quality of the training experience that our doctors have here in Wales. If we were to improve that and our exam pass rates, then I'm sure they would want to live, stay, work in the NHS here in Wales. No, we firmly believe that we can't. However, I'd have to say that the issue around service and training aren't totally intimately linked. Our job is to ensure that we have the best training for the junior doctors in Wales, and in order to provide that, that has to be on less sites. Clearly there would be a knock-on effect to removing trainees to centralise them for the rota and training to the service, and to that end the service reconfiguration would be a great help to training doctors and therefore the future workforce for